Unfortunately, sometimes we don't do a great job in educating patients before transplant, what they may get or what they need to do to prevent it. I'm finding out that, especially when I talk about tuberculosis, they need to share with us if they've been exposed to other individuals with TB, and this way we look for risk factors. So we have to ask the right question, but also we want to make sure they understand it's very important to get the right answer, because every patient is different at the level of risk for tuberculosis. So history is very important. We need to know even 10 or 15 years ago if they've been exposed to anyone's tuberculosis, or they work in a place that could be at risk for tuberculosis. So this will help us as physicians to have a good strategy for them to look for TB if we need to. For CMV, unfortunately, it's less well known as kind of virus causing a real problem in our stem cell transplant patient. It's very common first, and most of our patients, as soon as they get immunosuppressed, the CMV will start show up in the blood. So they need to understand how serious it is, because sometimes it show up in the blood and they can be completely asymptomatic. So when their physician or their doctor tell them, we have to check the blood every week for CMV, hopefully they are compliant enough and get it done, because we have to catch it early before it causes disease. It could be pneumonia, it could be colitis, which could be very serious and hard to treat. We need to educate patients better, and they have to follow our recommendation, because prevention is very important, and we want to prevent infection instead of treating infection in this patient population. So what I do also, what I tell patients all the time, so especially early after transplant, if you're in a big crowd, better to wear a mask. You want to prevent respiratory viral infection and other communicable disease. Wash your hand as much as you can. Don't sit next to someone who's sick, coughing or sneezing. Don't eat raw vegetables unless you wash it pretty well. And make sure whatever you eat out in restaurant, that are grilled or well-cooked meal. So there's many ways to prevent communicable diseases for our patient. So they have to follow basic infection control measures, and they should be fine most of the time.